Hello and welcome to another episode of the Dr. Tara Hogan podcast. Today, we are doing a part 2 with Alex Clinton because after speaking with her, I wanted to go through the motions and see what a real live initial consult would be like with her. So we're going to use my son as an example today. And she is going to walk us through what a myofunctional approach would look like. And what a consult in that field would look like. And we're going to go ahead and use a real life patient, my son. And if you would like to listen to the first episode, you're going to learn a whole lot more about what airways have to do with health and what myofunctional therapy really is. And so I want to say welcome to Alex, and I'm excited to go through the process with you today.
Thank you, Tara. I'm looking forward to it as well. So we're going to walk through what an initial consultation is when you're working with a myofunctional therapist online. So what I had Tara do ahead of time was take a series of photos and videos of her son, which as a teenager, it can be a challenge to do because they're like, what is going on here? So what we want to be looking at is full body and from the shoulders up, looking at structure, looking at side profile, and then looking at what's going on in the mouth. So sometimes the photos don't always show us what we need to see, but it gives us a really good idea on what we should be focused on. So before I even start looking at the photos, I usually go through a medical history form, and I call it the life history form because it's not just medical, it's not just dental. And as you were filling it out, Tara, you could see from birth, asking the questions, what was the birth process like? How was breastfeeding? What types of struggles did you have with breathing, enlarged tonsils and adenoids? Because he did have treatment done when he was quite young. So you had mentioned, so we're just going to go through the forms. I don't want to lose you on this. But I made some notes here because I wasn't sure between the app if we'd be able to. So your chief concern for Max were a tongue and lip tie, that he has a mouth breathing habit, and he actually chews with his mouth open at times when he's eating. You notice at night that he's clenching and grinding his teeth, possibly has sleep apnea, seems to have poor sleep, doesn't always wake up feeling well rested, and has issues with focusing and attention span at times, and stress management strategies at times. So there's some nervous system regulation issues that sometimes there can be a huge correlation. There's lots of information coming out right now about ADD, ADHD, and how it's not a medication deficiency. It's more of a sleep quality issue. So if your child isn't waking up feeling well rested, getting an idea of what's the sleep quality like, is he able to get into mild REM, deep, and light sleep, so that we know where those issues are coming up, as well as if he's hypoxic, if it's affecting his SpO2, which is his oxygen. So if his numbers are getting lower when he's snoring, which usually happens, we want to make sure that we can address that in a functional way, because it could just be a mouth breathing issue. We need to just close the mouth, and there's different ways to do that. Or it might be a structural issue like severely enlarged tonsils and adenoids, or something structurally in the nose that's not like inflammation, that's not allowing enough airflow. So you don't want to just tape the lips for the sake of taping the lips. So you had mentioned another concern that you had was he was very prone to decay as a child. Like he had teeth that crumbled. So his first adult molars did not hold up well. So you had to have them removed, and then some orthodontics were done to try to align them. He's got a beautiful smile. From the photos that I see, things look really good. Looks like things have erupted and developed well from what you were telling me from his history. And then previously he did see an ENT because you had mentioned there were some tics at times, almost like facial twitches, I'm going to call them. And you said
like a throat clearing.
Oh, like a throat clearing. Okay. And so there could have been some inflammation.
More like a back of the throat, like a
well, like a clearing. So like
it was constant. It was like a lot.
So I had noticed that
kind of like
with
that.
Adults as well. They'll wake up in the morning and they're trying to clear something. So you might hear them like constantly clearing their throat. And I'm saying this because I see and hear this a lot. Or people get up in the morning and they are really having to clear aggressively and the whole household hears. So that can be heavily correlated with allergy issues. So if there's certain types of foods, food allergies, sensitivities, inflammation at the back of the throat causing more congestion, dairy is a huge component of that. So I noticed that you had checked off food sensitivities. What types of foods is he sensitive to?
So we did a whole gut rehab thing, and with the throat clearing, that was like, and it was seasonal. It was very much in autumn and in spring. And he hasn't really done it anymore, but I would say the food sensitivities is more a past thing. When we did all this gut rehab, we did, enzymes and probiotics, and we, targeted which food sensitivities they were with a blood test. And so we cut those out, and we did bone broth, and, for a period of about a year, and we retested, and he had virtually no sensitivities. So we did some of that, gap junction, like gut healing stuff. And that seemed to really improve a lot. And he was also a picky eater. And after that process, he is like my least picky eater. So I would say like the food sensitivity stuff is a thing of the past. But, it can always arise again. And being a teenager, right now we're struggling a little more to get him to eat enough protein. I would say he's an athlete, so making sure he's getting fueled has been kind of our biggest struggle right now.
Okay. And since the teeth were removed when he was 8, has there been any issues with cavities ever since? Now that he's 14.
Actually, it's like really improved.
Awesome.
Like I was very surprised because we really struggled with the baby teeth, it felt like, and then he hasn't really had any problems
Awesome.
Since then.
And this is why I'm touching on this.
And I think maybe
because the baby teeth develop when you're pregnant. So if there are any gut issues, food sensitivities, absorption issues, high stress, like maybe you were starting your practice at that time, or you had bought a house, or all of the above, then that contributes. So if you had deficiencies, that's when it shows up in the baby teeth. So I always tell moms, and this is why I wanted to touch on this, is a lot of these moms that really know what they're doing, but maybe didn't know this information when they were pregnant. And then they have babies, and their babies are like 5, 6, 7, 8, and they see the adult teeth coming in, and the baby teeth have had to be treated for cavities or early extractions due to severe decay. Then moms are like really supplementing hard. And it's great because then all the adult teeth are underneath the bone. So they're getting all the minerals and the nutrients, and the proper absorption is happening because of the work that you did. So now you've set him up for life. You didn't have this information when you were pregnant. And now that you did and you implemented it, this is how I tell moms, like, don't beat yourself up. Don't give yourself a hard time. The baby teeth are a sign of what happened 10 years, 5 to 10 years ago. And the adult teeth now are showing us what you've done in the last 5 years. So that's huge. That's awesome. So I'm so glad to hear that. Now, has there been any recommendations for orthodontics moving forward now that he's 14, now that all his teeth are in, or were they able to address that once the last molars came in?
It was super surprising to me that when those molars came in, it was like everything just fell into place, which was really incredible. But we are holding off on any orthodontic, any of that, just because I want everything to be kind of fully developed in his cranium before we do any of that orthodontic, like even consultation. So that's just something that, we're holding off until he's a little older.
And most of the time when I'm having these consults with parents, I'm seeing younger children. So we always say don't wait. And even at his age, there are things that we can do. It just means, are there the right providers in your area to be able to support him? Because there are types of appliances that can work more osteopathically and work more cranial. So you get those cranial rhythms still, working the way that they should. Yeah. But it can be very challenging to find that type of equipment because, as you know, working as a chiropractor, you were seeing kids with expanders and retainers on the front teeth, stabilizing the teeth, but you can feel that their cranium is not moving, their head is not moving at all, and it's causing all these structural issues down the rest of the body. So what I'm going to do now is share my screen. Exactly. So I'm going to share my screen and show you the photos that you took. And let me know how that looks. So is that a line there, Tara?
Yep, it's up.
Okay, great. So the very first photo, now can you see my pointer circling around his face?
Yes.
Okay. So what I'm looking at when I'm looking at these photos is I want to get a really good sense of what his structure looks like. So not just from the shoulders up, which we've talked about, but from the shoulders down. So most of the time I'll ask parents, can you, whether you're an adult or a child, wear as tight clothing as you feel comfortable. Sometimes with guys, we even have them take their shirts off because I like to see what the shoulders look like. Here I can see that one shoulder drops down more than the other side. And sometimes you can see rotations in the elbows, the hands. Sometimes you'll see the hands rotate out or in. So that's very interesting to look at as well as the ears. If his hair was a little shorter, with men, most of the time, I don't have to make any comments, but with girls, you want their hair tied up and way up high because you want to see where the ears are, because the ears are telling us what's happening with the temporal bone. So if there's any structural changes, you may see one ear sticking out more than the other. You may see some rotational patterns, and even this a little bit of shadowing in the bathroom is not giving me as clear of a representation. So, but this is a really great baseline to start so that I can see what his structure looks like. So the other thing I'm looking at here, it's going to let me zoom in. Let's see if it's going to let me zoom in. There we go. So the other thing I'm looking at is the smile line. I'm seeing, is there any changes structurally there? I'm looking at his eyes. Are they canting down or do they look like they're pretty level? That's telling us what's going on structurally with the rest of the bones, right? And then looking at the eyebrows. So we're not designed to be completely symmetrical, as you know. But sometimes some of these structural changes can show us what's going on. And he's got a beautiful smile, but can you see that little dimple in his chin? Like it could be genetic, but there could be tension there. So it's hard for me to know, but I'm just, yeah. And then if this shirt was tighter, I'd be looking at what his hips look like, knees. I see a lot of kids, their knees tilt in, and I'll actually get them to do like a jump off the couch, like something that's safe, not too high. And I want to see when they go to jump, do those knees collapse in? Or does one knee collapse in? And if they do, let's get a body worker on that to structurally support their structure and get them doing certain exercises where they're not sitting with their knees touching, that they're sitting at, maybe use a yoga block or something to help stabilize, and then certain exercises to help support that. The other thing I'm noticing is his feet. His feet point out. And this is why I wanted the socks off, because the socks off will show me, hard to see from this angle, but the ankles dropping in. So am I seeing those arches of the feet collapsing in? And then are the feet pointing out? So when I have multiple photos of kids from the front, the side, the back, and the other side, I can see those same patterns as they're rotating. So it's not just for one photo that they took, and they kind of stood in a different manner. I can actually see those patterns as they're turning. And then other things I want to see are the toes, because the toes tell me a story of what types of shoes that they wore. So if you see people that put their kids in all those really great athletic shoes that are tight, when they hit the toes, you start to see the toes cross over. And as kids and adults get older, you start to see more of those structural issues. So I want to see, are his toes not overlapping, and can he splay his feet and have good balance and grounding, or do we need to work with people to be able to support that and work on certain exercises? So then I'm going to show the side profile. So if I was to draw a line from the middle of the shoulder and go up, his ear should actually be here where my pointer is. So he does have head forward posture. You can see that curvature in the neck. You can see that rounding in the shoulders. You can see the shoulders slightly coming forward, and you can see his jaw. So sometimes when you have kids that struggle to breathe, they'll have more of that salute posture, almost like in the military. That's telling me that they're trying to open up their airway. So if you notice that with kids in particular, that can be a sign that they're trying to get into the CPR position, right? You always lift the chin and it opens up the airway. So he's not he's not to that same extent. But what I'm looking at here is if I was to draw a line from the tip of his nose to his chin, the upper and lower lips should be hitting that line. So his upper jaw, the maxilla, and his lower jaw, the mandible, are slightly retreated back. And that's because of the tongue. So if the tongue is up, it actually allows this portion of the face to come forward. When the tongue is down, you can have this, straightest, nicest teeth in the world, but it's not going to develop this portion forward. And what a lot of airway-centric dentists and orthodontists are doing is like a reverse pull headgear. So they put like a bow either here to here, like a crossbow, if you can imagine what a crossbow looks like, or it goes from here to the chest and they pull things forward. And you could probably tell me how much that would structurally compromise everything else in the body for straight teeth. So in certain cases, it's definitely appropriate. In other cases, I'm on the fence about it. So that's what I'm looking at here is what is his forward growth? What does that look like? And his jaw, his lower jaw, right, hasn't been able to come as far forward. So where is the tongue in all of this? It's further back. So we have to figure out why that is. If the tongue is primarily low, there could be some underlying breathing issues. And I see this a lot with kids that go through a whole myofunctional therapy program, and they go through orthodontics, and they go through, gradual expansion or rapid expansion, and then you put braces on, and then you stabilize that position. But this wasn't addressed, and the breathing wasn't addressed, and things start to collapse back. So it creates an unstable position. And then I had you take the same photo here, but I had you take the sweater off so that I could see that, because sometimes this impacts being able to see this. So as you know in your field, every 5 degrees that the head comes forward, 10 to 15 pounds. So he's a chronic neck patient.
Yes. So, and part of this, I will just say, is the kid loves video games. So it's something that we're really struggling with right now. And I think it might be helpful for him to actually see, another provider telling him he's got some forward head posture. And I'm sure it doesn't help that he's a wrestler and they are doing a lot with their neck and that. So, yeah, absolutely. The forward head posture is definitely a thing we can focus on.
And this is why I wish providers would take photos every year, because I've been taking photos of my structure since 2020 because I started working online, and my structure has changed and not for the better. And I'm doing all the things, like I'm trying to keep my posture straight and I'm trying to do all these things. But when you're spending so much time on technology, there's compromises. So finding what that balance is really key. And then using different types of seats. So I like saddle chairs. That can be really helpful because you have to sit up straighter. You have to engage your core in a certain way. If you try to, relax your stomach muscles, then you come forward. So, and your feet are touching the floor. So I go over all these things with parents as we're walking through this to say, hey, how can we limit screens? But then also when he's having his screen time, what things can we do that will be positive for his structure and for his breathing? Maybe he will be lip taping while he's gaming, doing certain things to help support his breathing. And then the next one I was going to look at was the lip closure picture. So you can see that when we got a closer photo, you can see that tension in his chin. So it's telling me there's a little bit more tension here to keep his lips closed. If he relaxes his mouth, then that chin muscle will relax. So it's telling me there's a lot more musculature that's involved to keep those lips closed. So we have to strengthen this. So it will just be second nature like you're doing right now. Your lips are nice and closed. Your facial muscles are nice and relaxed. That's the way it should be. But if you're primarily breathing through your mouth, then that becomes the more relaxed position. And tongue posture. Is the tongue down? It usually is. My chin will even dimple when my tongue's down. When my tongue's up, it's more relaxed. So those are some of the things we're looking at here. And then this was a little tricky, the back of the throat, being able to see, but I'm looking at his tongue, looking at his teeth, and then I am going to pull up these photos that you took. So his upper arch, so I can kind of see. Let me see if I can lighten that up a little bit. So he does have more of a vaulted palate. So it looks narrow up there. And if we were to measure those first molars, that measurement might be okay, but he's more narrow in the front. So it's telling me that the tongue isn't resting the way it's supposed to, because if the tongue is up, then the teeth are going to come around the tongue. So he has some narrowing in the front as well. When I'm looking at this here, his teeth all fit. He's got a beautiful smile.
Well, and that's like, yeah.
But there's some crowding, and it's because this portion's narrow here. And if this is narrow and vaulted, the nose is narrow. It affects the structure of the nose and the airway.
Yeah.
So if this gets bigger, this gets bigger inside as well. So that's what I'm going through with parents when I do the second part, the functional eval. I want to see what his breathing patterns look like. I want to see what his nose is doing. I want to see if he's actually able to get adequate airflow so that he can function optimally when we start working on keeping those lips really closed. And then I'm looking at his tongue. Now it's really hard to tell from this photo, but there could be some tension there. And then here. So he has an amazing elevation pattern. He's slightly off to the side, which if you just do some intraoral work on him, you could take that photo right after you do a massage and place your fingers and wherever there's tension and just hold, and that tongue will straighten up. And I know that because I have that too. So I've had body workers do intraoral work underneath the tongue and my jaw, and it's helped straighten out the tongue. But you have to figure out what the reason why is, or it's going to continue to go back. So he has a great opening, and what we're checking is when you open wide, we measure that. From top teeth to bottom teeth, what is that max opening? Then we have them touch the tip of the tongue just behind the front teeth. How much do you have to close? That's telling us the level of restriction. So for him, he can probably open fairly wide and barely close when he touches the roof of his mouth. Some people who are more moderately to severely restricted have to close a lot more. But I'm still seeing the floor of the mouth elevating. So it's telling me that there's still some tension underneath his tongue. But from what I'm seeing, and I'm not a dentist, so I can't diagnose, and I can't recommend tongue tie releases, but when I see cases like this, I would say, let's get some measurements. Let's see what his mobility, his range of motion, and his tone is like. And then let's reevaluate that in 6 months, because I wouldn't put you in a yoga class for the first time and have you touch your toes and do all this, all these different types of movements. And if you can't do them, just cut you. Like, oh, let's just cut these muscles so that you can touch your toes. No, we would give you time to get the body moving and see if we can make those changes. Because anytime you cut tissue, you create scar tissue. And scar tissue has more tension. So you have to do more exercises, more intraoral work, more stretches, maybe work with some proteolytic enzymes to help with reducing that scar tissue. And sometimes that is a really great tool to use, but we want to make sure that we're doing the best we can before jumping right into a release. So that's my recommendation. And some of the providers I work with are on the same page as that. I can see them saying, you know, give it 3 to 6 months, see what happens, and then we can kind of reevaluate, see how things look. And then it gives you a sense if he's actually going to do the exercises. Because if you don't do the exercises, the tongue stays low, you're breathing through your mouth, then you'll get even more scar tissue. Now looking at his lip tie, did he fall and bump his face when he was little? Do you know?
Oh,
Probably all the time.
I mean, this kid, well, I mean, part of our struggle was because of the gut issues. Um, it made him like the drunken sailor. So he was very off balance when he was very little. And he did actually, I think a lot of our brain struggles came from, I'm pretty sure he had a concussion when he was about 1 year old. He did hit his temporal bone very, very hard. And I've had to do a lot of cranial work with him. But I mean, there's no telling. Yeah, he was a rough and tumble little kid. And yeah, he's definitely fallen on his face probably.
Because if you ever have someone lift their lip up and you see a little bump, sometimes that can be that they tore that tissue. So they did a partial release on their own. The other thing I'm looking at now from a dental hygienist, and they're not coming from a place of judgment, just showing you what I'm seeing. His gums are quite red. They look quite inflamed, and there's a moderate amount of plaque around the gum line. And I see that a lot with kids that primarily breathe through their mouth. Their gums always look red and inflamed because it may be more of a dry environment. And then depending on the types of foods that they choose to eat, just creates more inflammation and issues there. So I'm always telling kids, get the toothbrush right up to the gum line. Maybe not every dental professional would recommend the same thing, but I tell them, I'm like, I want you to brush your gums because I want you to get all that food off, because that plaque can actually sit there and discolor the tooth and cause staining, and the staining never goes away. There's sometimes options we can use, like almost like a whitening type of material, but there's no guarantees, because if you whiten this, you whiten this. So we just want to make sure that oral health is being addressed as well, because when the lips are closed and the tongue is up and you're producing saliva, you're bathing the teeth in saliva, which is nature's toothpaste, which we discussed previously. So when the mouth is open and it's dry, you're more susceptible to gingivitis, which is gum disease, and plaque developing on the front teeth. Because I will have kids all the time tell me that they're brushing their teeth, and they'll show me, and medication can also cause this. So I'll have certain people that will say, I'm using an electric toothbrush, I'm using a water pick, I'm doing all these things, but they're on certain types of medication like ADHD medication. A lot of kids I'm seeing are on ADHD medication, and that some of those side effects are dry mouth. So just being aware of that and not getting too discouraged. I think I always tell parents, understand what the side effects are so that you can be even more diligent and be aware of that. Okay, and then his smile photo. So he's got a great smile, he's got great lips. When I'm seeing kids that are primarily breathing through their mouth, this muscle, the upper lip, becomes almost weaker because it's not being used. So you'll see a thinner lip. Once I start myo with children that have thin upper lips and they're using devices that go in the mouth, that they're chewing or holding, doing certain types of exercises, this lip, like muscle, has muscle in it, right? So you can develop it. So you can have more fuller lips. So he's got great full lips. You know, we talked about the ears already. We talked about the eyes. I'm looking at the symmetry of his smile. If I'm seeing kids with more narrow, vaulted, tiny mouths, you'll see darker corners in the side of the mouth as well. So that can be varying depending on what their structure looks like. You had previously sent me photos of the back of the throat, and I could see the tonsils slightly. Do you know if his tonsils are inflamed right now? Have you looked at the back of his throat?
I do not know, but I said, when I took the picture, I said, how has your throat felt? It to me looked a little red.
Yeah, so if he's snoring, if he's mouth breathing, it's going to seem more inflamed at the back of the throat. And if he's coming down with something, this is cold and flu season. So one tool I always have parents test is vitamin D this time of the year, because if you are more deficient, then all of these symptoms start to show up. I see more sensitivity, more inflammation in the gums, more sleep issues. And if they're able to test and take the right amount for what they need, along with magnesium, K2, other things to help support, then it's also going to support bone health, not just sleep quality and inflammation. And then his sleeping photo, you did a really great job. Great lighting, great lip seal here. It looks like he's breathing through his nose nicely. And this is what I always hope to see when parents send me a photo. However, most of the time when you're on your back, if your tongue isn't resting on the roof of the mouth and the tongue drops down, then the mouth is more likely to open, and then you get that snoring effect. So there's different areas in the mouth and in the back of the throat that can cause snoring. So it's not just the tongue dropping back. There can be some airway restrictions in the upper part of the nose and lower down in the throat where you get that collapsing in due to almost like a pressure. So when we're talking about this is why I always want parents to know that the number one, the gold standard, is to see your medical doctor in North America, and then your medical doctor refers you to an ENT. So if you are extremely worried about your child's sleep quality, that is considered the gold standard. If I don't say that, it's seen as almost neglect, because parents need to know this information and how important it is. Because if their child is snoring, apneic, not getting enough airflow, that's hypoxia. Hypoxia is lack of oxygen to a growing person, a growing brain. It's brain damage. So this is why I'm so passionate about explaining this to parents, because I want to make sure that they understand the importance of this and they get on it. Like, there's things we can definitely do to support. There's things that we can do from a healthy standard while we're waiting, because unfortunately, the wait time to get into an ENT, especially in my area of Canada, is 1 to 2 years if your child isn't severely struggling with breathing issues. If it's an emergency, they get you right in. But if it's not an emergency, then they're going to recommend more testing, possibly a cortical nasal spray. So I always tell parents, make sure your number one person that you need to talk to is your medical doctor and ENT. But if you're waiting, let's see what we can do in the meantime. So there's nasal sprays. There's airway-centric dentists that can start expanding. It may not be the root cause. Sometimes you see online, it makes a big difference for kids. But if it's not the root cause, you're going to still have them snore no matter how big their mouth and their jaws get. So every child's very unique that way.
So let me just ask this, because recently, for a period of time there, maybe 2 weeks ago, for a couple weeks, he was having a lot of bloody noses. But then I started doing some cranial work on him, and like, he hasn't had one in a while. But I'm just wondering with that, I mean, it was very odd. It was like every day for like a week until I really kind of got in there and did some work with him. I'm wondering if that's tied
And
into this.
nose bleeding is complex, because I've had certain kids that they start using nasal sprays and they get a bloody nose, like a cortical nasal spray. So he's not using that. Did his diet change? Did anything happen with air quality, stress? Was he sitting more than he typically? Stagnant lymph and flow? Any flow issues?
Well, okay. Yeah. Okay. So he was running cross country, and there was a lull in between his exercise. So that was right about the time cross country ended, and he hadn't started wrestling yet. So there was, he was a little more sedentary in that period
And
of
I
time.
do notice that kids that are more sedentary at times, it affects how things are flowing and moving, and you can feel it in his structure, right? Like in his skull, cranium, his whole body. So I always tell people, after you have body work, drink a lot of water. Make sure you drink good quality water that's filtered, that has minerals, that has silica, that has good salt, that's allowing your child to get hydrated again. Because if your child was severely dehydrated and you had to go to the hospital, would they just give your child water? No, it's a bag, it's a solution with all that, with minerals and things that we need to get hydrated again. So parents are like, oh, right, like, you think your child needs water, you just give them a glass of water. Make sure they're getting properly hydrated. And then the body work is so key with what you were doing. Because I have so many children that start my program and they're trying to use a device that goes in the mouth and it's not working for them, but they don't have great breathing capacity. They don't have good airflow coming out of their nose. So the big effect in changing that and improving that is doing the work that you just said, craniosacral therapy and structural, like osteopathic types of movement to get the cranial rhythm moving and flowing again. And then the nose, you can check it to see if the nose is actually getting, if there's enough airflow coming in and out of each nostril. So I always have parents check that to make sure, and then check it after the appointment's done with the body worker, or if you're working with a naturopath, or both, and see if that's improved things as well. Awesome. And then we're going to go to the videos. Now, the videos were a little bit challenging, right? But typically what I'm looking at, and I'm going to actually take the volume off just so that we can see what he's doing. You may not be able to see it because I have it on. I may just have it on the photos here. Yeah. So I'm going to explain it to you because each video is separate. All the photos, I was able to share them, but each video is its own separate file. So we'd have to go in and out. Okay. So with the videos that you have, you showed me a video of him eating an apple. Now, he was thinking this was a very silly exercise, so he was really getting dramatic, which was great. But I could see that he takes big bites. He chews with his mouth open, and if kids are struggling to breathe through their nose, then they also can't keep their lips closed while they're chewing. So that's what I always want parents to check. It's like the very first, after we've done the initial consult, I'm like, don't judge your kids, just watch them. How are they drinking? How are they eating? How are they speaking? Are you picking up on anything? And then we can discuss it at the follow-up. And I was looking at the drinking with the cup video, and he's got a lot of almost pursing when he drinks. So we talk about those muscles being engaged and how if you're using too many of these accessory muscles, you can get pain from that because you're possibly bringing liquid or food forward and then bringing it back, depending on how your tongue's functioning. So if he has a tongue thrust or if he has a poor lip seal, this can all impact chronic pain issues down the road. I don't see it with kids a lot, but more with adults because they've been using those muscles not the way that they're designed to be used. And his speech. So you had him read a book and his speech seemed great, even though he was talking throughout the other videos. I didn't pick up on any sounds. And the reason why we get a video of him reading or telling a story is because we want to see if there's any underlying speech issues and we want to see tongue posture. So when we're talking about tongue posture being low with speech, it sounds like this, because when the tongue doesn't move from the bottom of the mouth, then you can't articulate those words effectively. So that was a very dramatic version of low tongue posture speaking. But sometimes you can see that with certain kids where their tongue is low and they say a certain word and they just can't get that word out. It's either the tongue can't properly move due to thumb sucking, finger sucking, extended pacifier use, extended bottles that allowed the tongue to stay down and change the position and structure of the mouth. And it could also be that there's a restriction underneath the tongue called a tongue tie. And depending on that level of restriction, it's like a dog on the leash. So the shorter the leash, the harder it is for that dog to, be able to walk. And so the tongue is in the same position. It's a grading variation scale. It's not, everyone's tied or not. We all have the anatomy, but we all have different levels of how much tension we have underneath the tongue. So I would say he's in the less restricted category from the limited amount of information that I currently have. We would find out more with the second part, which is the functional evaluation, to be able to really get a sense of where he's compensating and certain movement patterns that he may need to work on. So that's what's involved with an initial consult. So I would say in his circumstance, what I would do next was I would start with the next appointment being a functional evaluation, going through that, and then I usually give a few exercises for parents to get started. And then we work through the way that I do programs when I'm working one-on-one with people is 4 myofunctional therapy sessions within 2 months, so that we can really get a good sense. So it's within 2 to 3 months, we do phase 1, see how it goes. Because by that point, if we were referring to an airway-centric dentist, if we were working with body workers and naturopaths, we want to see if we can make some improvement. And then if he ends up seeing an airway-centric provider for expansion and certain devices go in the mouth that are a challenge for me to work as a myofunctional therapist, now you have the basics down. You go through expansion, depending on what that looks like. And then after he finishes expansion, then we could progress and carry on with myofunctional therapy. So every case looks different. Every recommendation is different. I always tell parents, you could have 4 kids in one family and they all need very different things. Like I just saw a 20-year-old last week and the mom was like, we need to get him breathing. And I'm like, well, he's an adult. So, it's kind of hard to be able to, if I was 20 and my mom was telling me this, I wouldn't be doing it. But after we finished the evaluation, I said, hey, just be open-minded. Let's do the evaluation. Let's see. And then I realized, he had his adenoids removed when he was very young. And the studies showed that they grow back in 5 years if the root cause isn't addressed. So I actually think that he couldn't breathe and she was trying to get him to tape his mouth closed. And I think there's a structural issue going on. I think there's a bigger underlying issue. And so by the end, he was open. He was like, yeah, you're right. There is something going on. Let's touch base with my medical doctor and ENT. Let's get to the bottom of it. Because in that circumstance, there's not a lot I can do if someone can't comfortably breathe in and out through their nose. So I threw a lot at you, Tara.
Yeah. Yeah. So, and he does say he kind of is just stuffy in his nose as well. Do you think that is a result of the more narrow, like, front of the palate, like by the front teeth?
I don't know yet. It's hard for me to know. Sorry, my eyes started watering. It's hard for me to know what exactly is going on structurally, because I find the way that I was trained was do this 90-minute to 2-hour consultation and assessment appointments with parents. And by the end of that 90 minutes to 2 hours, everybody was cooked. Too much information, too much assessment, too many recommendations, then do some exercises. So I said, I'm not doing that anymore. I'm doing an initial consult. We'll just get a sense if this is potentially a good way to continue on. And if I think that doing the next phase of this, which would be the functional evaluation, or I'll have parents say, you know what, right now we got a lot going on. Financially, physically, it's the end of the year. There's a lot going on. And so jumping into a program and investing a certain amount of money is a lot for parents. So that's where I created Building Healthy Faces, phase 1, the breathing optimization program. So then instead of working with me one-on-one for about 2 months, 4 sessions, it gives parents the option to just pay for the course, whether they've seen me or not, whether we've done the initial consult or not, because I've actually, what we just did, included it in the program. So this is kind of showing parents what I'm looking at as a myofunctional therapist to give them the myofunctional eye so that they can see that on their child and then say, hey, my child is struggling a little bit more than this guy. Maybe I should follow up with my medical doctor and ENT, or, it seems like my child actually would be a really good candidate and we could still work through this. So whether their child is severely compromised or doing or think is doing pretty okay, but there's things that we can work on, then that program is just essentially working through that first phase as a group. So I give parents both options. So one-on-one, it would be doing the functional eval, doing 4 sessions of myo, or just going directly to my Building Healthy Faces, phase 1, the breathing optimization program, so that they can do it more at their pace, financially less of an investment, working as a group so that you can get on these bi-weekly calls with a group of parents and practitioners and discuss certain questions that you have as a group.
Very cool. Very, very cool.
So if you do have access in your home to a nasal spray or to a saline rinse, I would get him started on that. That would be one of the first things I would do. When I'm doing, go ahead.
Are you like a neti pot type
It
thing with the
depends.
saline?
It
Is that kind
Have
of
you ever done a
something,
neti
or
pot with him? Has he ever used?
yeah, I'm trying to remember. I'm trying to remember. Maybe he hasn't. My one kid loves it.
Awesome.
He wants to do it all the time. Hit this one, I'm like, I don't know if
So
he's ever tried it.
I find
Thinking back, I
when
don't
you
think he
jump
has.
to a
Right?
rinse
Yeah.
where you're squirting a bottle or the neti pot into the nose, even for adults, they feel like it's kind of invasive. So starting with a spray can be a great place to start, and then you can transition them. It's just like appliances that go in the mouth. If you throw a massive, big, silicone or, certain types of devices that are blocking the airway and structure, it's going to throw kids out of their goalposts.
Yeah. 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 What was I gonna say? I forgot what I was gonna ask because I was thinking. So, like, just like a regular saline spray. Oh, I remember what I was gonna ask. Um, what are your thoughts on, like, I've heard of like sinus probiotics or like nasal spray. Like, is there like a flora within the sinus cavities or like
That's a
within
great
the
question.
airways?
So just like the mouth, there's the oral microbiome. Just like the nose and the lungs, there's the nose and the lung microbiome. And even on our skin, there's a skin microbiome. So you want to support the flora. You don't want to use antimicrobial products. Certain people like ENTs get nervous about what types of substances are going up the nose because it can impact the microbiome, and it can also be very toxic if you're just using tap water that has other people's medication, has metals, has, chemicals in it for whatever reason. That's why you want really good filtered water to start. And then the biggest product that was recommended for a very long time was like a saline mixture. So you put, those packs of saline, or you make your own solution, and then you with distilled water, and then you use it that way. Now, a product that's been out, I want to say for the last 7 years, is called X-Clear. It's with xylitol. That's been my number one product. I've tried every type of nasal spray. I've tried a propolis spray. I've tried colloidal silver. I've tried a Neomed pressurized bottle. Like I've had families that say, I don't want to use xylitol. Can we use another type? Because they know the benefits and the consequences of using xylitol, because xylitol used to be from birch trees and now it's primarily derived from genetically modified corn. So people are on the fence about that, but I tell them, I'm like, if your child is congested, struggling to breathe, let's do this for 30 days. Let's see what happens. I'm not asking you to do it every day for the rest of your life or their life. I'm saying, let's just get the airway open. Let's get things more clear. Let's support the microbiome, because xylitol is a product that's used in a lot of toothpaste. So, there is more information talking about how xylitol can support the microbiome. And so just like we brush and floss our teeth, we also should be cleaning out our nose. So I always say the spray is like using toothpaste in your nose. Essentially, it's doing something similar.
Cool.
Yeah. So that's usually the number one tool I give parents to start, because I never want them walking out the door and they're like, now what? I'm like, here you go. Here's the spray. Buy it online or go to your health food store. I always tell people, get to know your local health food stores, because they're usually family run. or managed and operated. And they're usually really passionate people that are doing a lot of research on their own time and dollar to be able to give you the best products in your community. So most of the time, they'll have something. If they don't have X Clear, which is actually clear, but the first initial is an X. So I always say X Clear because then people see it. And they may have other options there. I'm not saying that those other options are bad. I actually really like the B Propolis sprays that they have for the back of the throat and the nose. I really like the colloidal silver sprays. I think it's Sovereign Silver that they have for the nose, but I just don't find I get the same benefit the first 30 days when I'm starting with a family as quickly.
Okay.
Great.
Very interesting.
So thank you, Tara. I'm glad we could go over this, and I hope this creates some clarity.
Sure. Cool. Yeah. So what are the next steps like, as far as, then we kind of do some of the sprays and all of that, like what's kind of like next?
So if we're working one-on-one, it would be the functional evaluation. So the second part. So we did the consultation today. The functional evaluation would be the next appointment. Most of the time when I have families that want to start, they're like, I want to start. When can I get started? When can I get my kit bag? Like we want to get moving now. The first part of the appointment is the functional evaluation. The second part of the appointment is the first appointment of myofunctional therapy. So that's where you're prepaying for those first 4 sessions. The functional evaluation, you get the kit. The kit doesn't include the bigger items just because it's very expensive. So I have people buy those bigger items so that when I see them next, then they're ready to go. But the kit bag just saves you from buying all the little tools that you need. That's one option. The second option was doing my already recorded program, Building Healthy, on buildinghealthyfaces.com. It's the breathing optimization program. Okay. So if parents don't want that one-on-one right now, they want to see how they're going to do at a fraction of the price, then they can just get started that way. And they can actually go online and purchase it at any time. Very cool. And it's the same tools that I'd be using in my practice as a myofunctional therapist, so that they have the option of going either way. And then once they finish, let's say, the first phase of that program, there's another phase coming, which is more of like a face gym, face yoga, and not just from the shoulders up. This is why Building Healthy Faces was not a myofunctional program. I wanted it to be a full, complete body integration program. And as you know, with a license, you're limited by some of the things that you can do. And I'm like, I want to get these kids moving and functioning and doing things. So I separated those two so that the one-on-one support is the myofunctional therapy through functional oral health, and then the online programs through Building Healthy Faces. Because when you build a healthy face, it supports building a healthy body, because it all starts with how we breathe. So those.
Yeah, absolutely. That's very, very cool.
Great.
Awesome. All right. Is there anything else you want to add, or do you feel like we've wrapped it up? Thank you all so much for listening to this part 2 of the Dr. Tara Hogan podcast with Alex Clinton. If you have not already listened to our first part, please go back and do that. You are going to find out some incredible, amazing information about airway health, about myofunctional therapy. And so again, thank you. And please check out Alex Clinton's program, Building Healthy Faces.